Hi, everyone. Thank you for letting me be here. And I'm also a medical student. I'm a fourth year at Penn State. And I'll be presenting our study is adhesive-based fixation superior to suture-based fixation in open retromuscular hernia repairs. And I'd like to take this opportunity to thank SAGES and the entire MIS department at Penn State. So mesh fixation in open retromuscular hernia repairs is thought to reduce tensile strain on the surrounding fascia, prevent mesh migration, and facilitate mesh ingrowth. While this has historically been achieved by percutaneous transfascial suture fixation, there's growing concerns that this method of fixation leads to increased immediate postoperative pain, which contributes to overall healthcare cost utilization in the immediate postoperative period. Adhesives such as fibrin glue are non-mechanical alternatives to mesh fixation, and we sought to evaluate if adhesive-based fixation was non-inferior to suture fixation. So to do this, we conducted an institutional retrospective, or an IRB-approved single institution retrospective chart review of 329 patients from 2012 to 2023 who underwent open retromuscular ventral hernia repair. Patients were further subdivided into two cohorts, adhesive-based fixation and suture-based fixation. We found that demographics and risk factors related to hernia complexity were similar between the two cohorts. And our primary outcome was wound-related complications. And in the adhesive-based fixation group, we found that there was overall a shorter hospital stay, a decreased total drain output, there was less surgical site occurrences, and reduced pain at 30-day follow-up. Adhesive-based fixation was also not associated, was associated with a lower rate of surgical site occurrences, but surgical site infections and surgical site occurrences requiring procedural intervention were similar between the two cohorts. There was no difference in rates of 30-day readmission, reoperation, or recurrence within 1 year. So, in summary, adhesive-based fixation in open retromuscular ventral hernia repairs was not associated with any increased wound complications, and it may decrease total drain output, decrease hospital stay, decrease 30-day postoperative pain, and also decrease surgical site occurrences, specifically incidence of retromuscular seroma formation. The results of our study do not suggest an advantage in adhesive-based fixation of mesh, but it does show non-inferiority to suture-based fixation in open retromuscular ventral hernia repairs. As a retrospective, non-randomized study, our findings are not without limitations, and future prospective randomized clinical trials are necessary to assess the most effective method of mesh fixation and also compare the potential cost benefits of adhesive-based mesh fixation versus fixation-free repairs. Thank you for your time.